Countdown. Okay, ready?
Yes.
Okay. So, hey, today we're going to do an endocrine-based video and basically talking about diabetic ketoacidosis. So, something that you may see on the general health history of a patient that may have, or that you may suspect that has DKA, would be somebody who has a history of type 1 diabetes, which is the most common, but also with that they fail to comply with their medication regimen or they admit to missing doses of their insulin. When you're assessing a patient with suspected DKA, overall their appearance, you may notice that they've had some severe weight loss, they may be confused, they may be extremely diaphoretic or they're sweating profusely, they may even complain of previous blurred vision or weakness. Have you had any of that in the past?
No.
Okay, good. When you start to assess like their thorax and their lungs and the back area, you may notice that they're having what is called cumosol respirations, which is very deep and rapid because they can't catch their breath. Kind of like that. Like they're almost going to hyperventilate in a way. And also you may notice a fruity odor to their breath, which today I don't notice that on him, so we're good. Do you care if I listen to your heart and lungs real quick?
It's okay.
All right. Just sit there. All right, will you lean forward a little bit? I'm going to listen to your lungs back here too.
Okay.
Take a deep breath. Okay. One more. Perfect. That's good. And I'm going to listen to your heart real fast. Just relax. Okay, good. So also with diabetic ketoacidosis, when you start to listen to the hearts or assessing their blood pressure, you may notice that they have a very rapid heartbeat or tachycardia, and also they may complain of, if they get up from a chair, of being dizzy somewhat. So that's what they call orthostatic hypotension, and that's a similar sign to a lot of other things. You have to kind of watch that. Do you care if I mess with your belly?
Go for it.
With somebody with diabetic ketoacidosis, they may also complain of nausea and vomiting, abdominal pain, polyuria, which is excessive urination, and excessive thirst. Have you had anything like that lately? Okay, perfect. So I'm just gonna... And this part's a lot easier if they are laying down. He's a little bit ticklish, so that's why he giggles. And a few other things that you may notice with somebody with diabetic ketoacidosis is they also may complain of headaches. When you do their ABGs or their arterial blood gases, you may notice that they are in what's called metabolic acidosis because their body is trying to compensate for not having their regular blood sugars. And also, in a very severe case, you may notice seizures, which we don't want that to happen, so you try to intervene as quickly as possible. So, I hope that gave you some information. Hope you enjoyed our patient today. Hope you guys have a good one.
Have a nice day.